Well, Anthony Albanese peddled the biggest lie throughout the election campaign when he flapped about his Medicare card day in, day out and told you that his little green card is all you'll ever need to see the doctor for free.
This little green and gold card, this thing here, your Medicare card, is this little green and gold piece of plastic. This, your Medicare card. The Medicare card.
Well, it was all a stunt, wasn't it? The majority of Australians believed it, that seeing a GP was going to be free and easy under Labor, and believed a scare campaign that the coalition would make cuts to Medicare. Yet how difficult is it to find a bulk billing practice in this country that does not charge you a gap fee? It's about as difficult as waiting for our power bills to come down under the renewables-only fantasy. Healthcare under Labor is not cheap, nor freely available as you were promised it would be. And it's getting worse if you need to see a specialist. Out-of-pocket costs for specialist doctors are now crippling consumer budgets. According to Medicare data, the average gap fee charged to patients has risen from $49.56 in 2010 to 11 to $117.18 in 2023 to 24, more than triple the rate of inflation. Now, the Health Minister, Mark Butler, has asked his department to provide wide-ranging advice on reform options. And according to The Australian, that would include more transparency, like forcing doctors to list what their fees are and clawing back Medicare subsidies that go to specialist doctors who charge what is deemed as excessive. Well, I'd ask, what is Labor trying to do here? I mean, are they actually seriously going to ask specialist doctors to take a pay cut? Are they going to regulate doctors' billing practices, really? There are suggestions that in itself would be a constitutional matter. Someone has to pay in the end. And we can see where it's going. It's going to be the taxpayer who ends up being left to fill the gap. It's going to be you who ultimately foots the bill, because how else is Labor going to do this? Despite the fact Albo told you healthcare was going to be cheap with your little green card. And the opposition is rightly asking questions today.
Well, I think one of the biggest lies of the last election campaign, Pete, was that all you would need to access quality healthcare in this country was going to be your Medicare card. The Prime Minister had backdrops, had, jackets, T-shirts, pulling his card out at every available opportunity. And the reality is Australians are paying $50 out of pocket on average to see their GP and $117 on average to see specialists. Now, for many, many Australians, particularly those with young families where you might need additional visits or more than just one, that is out of the reach of family budgets.
Yeah, and the Health Minister, Mark Butler, was out spinning tricky figures today.
There were 11 million free visits to the GP last month compared to 7 million the month before. So last month an additional 4 million free visits to the GP because of our investments, making a huge difference to the access to healthcare and affordability.
The reality is bulk billing rates have only slightly shifted from a year ago. Health Department officials told Senate estimates yesterday the official bulk billing rate for GP visits rose from 77.7% in October to 81.2% last month. But between July and September last year, bulk billing rates sat at 77.6%. So really the needle has barely moved in 12 months. Yet Labor announced it would spend $8.5 billion of your money to deliver 18 million more GP visits a year. And don't forget, its goals for the policy were merely based on an aim. The funding was to be spread over 4 years and only aimed to deliver bulk billing rates of 90% by 2030, in 2 elections' time. That little green card was nothing more than a Labor con.